Everybody. Welcome to this MST information seminar. Let me introduce ourselves first. I am Janet Ng. I am the program leader of the Master of Speech Therapy program. Next to me, we have Dr. Angel Chen. She is the deputy program leader of this MST program. And on my far left, we have Dr. Mantak Leung, and he is our clinical education director of this program. On my right-hand side, we have Ms. Olivia Yuen. She is one of our assistant professor of practice, and she's also responsible for our admissions. Welcome, everybody. As communicated earlier, this seminar will be conducted in English. For those who are interested to know us more, we have actually scheduled another information seminar in physical form. So we will have a face-to-face information seminar in January 2025. And in this seminar, we will also, apart from talking to all of you, we will be also having some activities that you may talk to our student, and you can also take a look at our speech therapy unit. So if you're interested, so stay tuned, and then you can sign up for this seminar later. So this seminar will be recorded, so don't worry. And if you don't need to copy and jot notes on the slides, because the slides and the video of this seminar will be published on the CBS website, which is the website of our department. Okay, so let's start now. And we will be talking about what we prepared. That's what is on the slides. And we will be also taking questions. So if you are joining the seminar, please feel free. You can send your question in the chat box. Of course, by the end of the session, you're also very much welcome if you would like to talk with us using audio and voice functions of this Zoom, okay? Now, so first of all, I think some of you may already know who are speech therapists and what are speech therapists actually. So speech therapists, we are working internationally. We are allied health and language professionals. So we provide assessment and therapy to individuals with communication disorders and swallowing impairments. So we normally work closely with caretakers and other professionals such as doctors, nurses, physiotherapy, occupational therapists. We provide evidence-based intervention to clients ranging from infants to elderly. So it's kind of a lifespan style of work. So depending on your work setting, you'll work with different people. So in different countries, the name may be slightly different. For instance, in the United States, we are called speech-language pathologists. And in Australia, we are called speech pathologists. And in the United Kingdom, we are called speech-language therapists. And in Hong Kong, since the 70s, when we started to have speech therapists working in the government setting, we have always been called speech therapists. So we're talking about that we take a lifespan approach in our scope of service. So if you see this table, you can see that we work with both children and adults. So adults, it means younger adults or the older adults, or you can refer them as elderly. So we will work with different communication and swallowing disorders. For instance, some of the issues associated with speech, that means the sounds, whether the sounds are pronounced precisely or about some fluency of speech, or it could be about voice, where some people have very hoarse voice, and or some issues associated with hearing impairment. For the language side, we work with, for children, so we work with developmental language disorder. And for adults, more commonly, people will think that, we're working with people after stroke. For example, people will have aphasia. That means they will be losing some of the language ability after either stroke or other traumatic brain injury. And more recently, we also work with people with dementia, Alzheimer's disease, that is more on the cognitive communication side. And for literacy, now we have a lot of speech therapists working in schools in Hong Kong. So they may be working with children, they may have developmental reading disorder or writing problem. So some people would term this as dyslexia. And for adults, again, if they have neurogenic disorders, they may also have problem with reading and writing. And for swallowing, it can be for younger one, they may have some feeding and swallowing disorders. And again, we have some neurogenic cases, that including those with Parkinson's disease, stroke, dementia, or some other head and neck cancer. They may also have this difficulty with swallowing. So we term it as dysphagia. Now, today we're going to talk about a couple of different topics. So first of all, we will have Dr. Leung sharing with us the education philosophy of MST. So we have been doing MST, offering MST program for more than 10 years by now. So we can share with you what is underlying the rationale of how we deliver this program. And secondly, and I will be talking about some unique strengths of MST, because I think all of you may be considering to pursue speech therapy. And you may also be considering to enroll in different programs locally. So there are different uniqueness in different programs. And then we will have Dr. Andrew Chang who will share with us the entrance requirements. And lastly, I will have Olivia who will talk with us some tips for you to prepare for our interview. So now let me pass the time to Dr. Leung.
Hi, everybody. I'm going to walk you through our program, and we will start with the aim of our program and then the underlying philosophy, and how do this philosophy and our programming align with the structures that we have now in MST. So our aim is simple. We want to train speech therapists who are able to work through the entire scope of service, which Janet has mentioned. There's adult and child over speech, language, literacy, and swallowing disorders. And we hope that after graduation, they'll be able to serve in Hong Kong and able to serve clients in Macau as well as mainland China. And the program is to design to equip students with professional knowledge and academic knowledge, skills, clinical skills, and also research skills to deal with the challenges that they face. And we call them as our entry-level speech therapists. So actually, at the time we start designing this program, we actually make reference to a number of advanced countries in speech therapies, including United States, United Kingdom, Australia, and Canada. We have overall understanding of how these programs are designed and how they deliver their program. And locally, we have our program has been accredited by the Hong Kong IST, Hong Kong Institute of Speech Therapists, in 2018. And the endorsement, we have the full endorsement, and the endorsement will last until November 2024. And we are actually currently finished another round of accreditation. Hopefully, we'll be accredited another 5 years through this exercise. So basically, our program actually is actually built on some of the existing advanced model of speech therapy training. So looking at the program, the program is actually hosted by the Department of Chinese and Bilingual Studies. The reason why I'm highlighting this is because of the fact that this department is a linguistic department. So our program has a lot of integration in linguistics and also speech therapy practices. And it's a full-time study, a total of 91 credit, and it lasts for 2.5 years. Actually, 91 credits is meaning that the program is a very compact course that we cover a lot of areas in this program. If you look at the program through this table, you will see that actually the program is divided into different parts. First of all, it's the practicum. the practicum go from clinical practicum number 1 to clinical practicum number 7. You can you're aware of the fact that clinical practicum 1 actually start at the semester 1 of the program, and it has 7 components of it, and the last one will be clinical practicum number 7. This is the clinical part. Another part is the lecture. Lectures actually covers the lecture cover in semester 1 and semester 2 of year 1, and the difference of this program, or the highlight of this program, is actually the problem-based learning, which is the major component of our year 2 learning in semester 1 and semester 2. And the third component is actually our research project. The reason why we divide into this categorizing or design a program is because of the fact that we have a look at all the programs existing in advanced countries. They usually divided into 2 parts. If you look at these 7 points, number 1 to number 4 are actually lectures. So they cover linguistics, psychology, and biomedical sciences, plus communication disorder and audiology. So these number 1 to number 4 are actually lectures on theories. And most of the programs in the world actually do have this part. And after that, the clinical practicum are arranged for the student. So student, after taking those lectures, will be assigned to, or they are assigned to different clinics to do their clinical practicum. And in the end, they get the clinical experience and the training needed. And for us, we have a special arrangement here. So you can see year 1 and year 3 are actually the pattern of most programs in the world. They started off like fundamental subjects, so theories of different fundamental subjects like biomedical sciences, psychology, linguistics, and speech therapy. And then they are assigned to different clinics for their clinical practicum. Our program, the specificity of our program is on the problem-based learning. We sandwich it with the problem-based learning in the middle. So the reason why we want to do that is that there's a big gap between the fundamental subjects and the application of those theory in the clinic settings. So we sandwich it with the problem-based learning, in which they are given case that we're going to encounter in our practice. And through the cases, we actually practice how to integrate those theoretical subjects into clinical practice. At the same time, they will have a triple jump assessment. In that case, they are given a chance to go over cases on paper and then go over assessment through papers before they are sent out to clinics. So that's the difference between, and that's the reason why we have this kind of design, problem-based learning, and that's why we have a 2.5 years of program. And in order to do that properly, I'm going to introduce our staff. We have staff over a number of different areas. So here are our professional staff, professorial team, that they have expertise over a number of the scope that we are going to teach. And then we have a strong team of clinical staff. They are experienced therapists. I would say that they're the best in Hong Kong, I would say. And through them, we can run our program properly. First of all, through our strong professorial team, we have a good theoretical teaching. And through this experienced clinical team, we can run our PBL as well as clinical practicum properly. At the same time, since we have the privilege of housing it in PolyU, and so PolyU is famous in the rehab sciences, and they have a clinical settings and a cadaver lab to facilitate the learning. So our MST program do have the chance of making use of the cadaver lab in the rehab sciences our rehab science setting there, so that our students will have experience with dealing with some 3D model and also cadaver to integrate what they learn in the books and try to apply them into our real practice. So our program is designed in a way that that we cover over a wide range of scope of service. We talk about the 8 different categories, and this is a slide showing you our transcript at the end of our study. Then students are clinical practicum hours are listed here clearly. That showing that they cover a range of practice area listed on the right. That include language, speech, swallowing, voice fluency, as well as multimodal communications. And on top of that, we want our students to be able to, on top of our students being able to apply theory to practice, we want them to be able to have the ability, the experience, or has the experience of doing research. The reason is that speech therapists are young professionals, and there are new scope coming up. As the profession develops, we have a new scope coming up. We want to train our students to be a mini researcher. So whenever they feel they are faced with new cases they may not seen or may not have experienced before, then they can deal with them professionally like a mini researcher. So our program will include the final year project, and the quality of the final year project is pretty high, and some of our results actually are publishable in international journal, and also we attempt to present it in some international conferences. So these are our philosophy behind our design, and the program itself. We try to align this kind of align our program to match the aim we set at the beginning of the curriculum development, as well as the core structure itself. Then I pass the time on to Jeanette to talk about our unique strength of MST.
Thank you, Dr. Leung. So I think a lot of you may have done your homework when you think about which program that you would like to enroll in. So let me share with you some uniqueness of our program. Now, Dr. Leung mentioned one very much uniqueness of our MST program is problem-based learning. And I will be talking about some more clinical practice part. And I know we have some questions coming in, and then we will ask the questions later in one go. So first of all, I think we need to know the job opportunities for speech therapists. So like we mentioned earlier, we have a lifespan approach to conduct speech therapy in Hong Kong. So for the jobs, we will work with preschool. That means, for example, some regular kindergarten or some children with more special needs, then they may be in a special kindergarten. And then when the children grown up, and some of them, then they will be still having issue with developmental language disorder, and a lot of them they will be in a regular so-called mainstream school, normal school. And for some of the children, they may have a more severe special needs. Then those schools they will be in a special school. So basically all the special school you can see speech therapists there. And then we also work with individuals who are a little bit older. So a lot of facilities, for example, residential care home for the aged, that means old age home in short, or some daycare center for the elderly, they will also have speech therapists serving there. And for individuals with other form of disability, so we also have some we call rehab units. For instance, individuals, adults with intellectual disability, so they will also have service provider either in residential care facilities or in ambulatory facilities. Now, a lot of people, I think, all the time, people will talk about, so would there be jobs available in Hong Kong for speech therapists? Then usually I will pass this question to Dr. Leung because you know that he worked in this profession a lot longer than us. I think he answered this question for like in the past, like maybe 20, 30 years, right? And I think we may not be the best person to answer this question because whether we have jobs available, it very much depends on the market. But I can only share with you what I can find now, which is we actually searched on Jump last night, Ming Pao Jump, because a lot of jobs for speech therapy has been advertised there. So when we search with the search term in speech therapy, and then I still find jobs. And I think we still have students graduating soon in January 2025. Remember that we are a 2.5-year program. That means our graduates will not graduate in summer, but they will graduate in usually middle of January because the exam is in December. So after all the logistics done, so they graduate in January. And then I'm arranging campus recruitment for some student on Friday, and then some other student also are looking for jobs. So that's why I think they were all having jobs soon. So I think that's not much an issue. And another, I think one change along years is that when we have more speech therapists practicing in Hong Kong, you actually see that there are some more senior positions. For instance, you see that among the jobs available on JOM, you can see that Education Bureau is hiring position which is called specialist in speech therapy. And you can see that they're not offering starting pay. That means that they're looking for some more experienced colleague. And this position, for example, if we talk about master of pay scale, the money side of it, the salary, this is from 0.23 to 0.33. However, this position has an internal promotion opportunity. Most of the people we know having this specialist 2 position, they will eventually have opportunity to be promoted to specialist 1. And by the time they go to specialist 1, then they will be having the maximum pay point in MPS 44. So on the right-hand side, if you can see the master pay scale here, the majority of speech therapists, if you are not getting a promotion, then you will be running from 0.16, which is a fresh graduate, and then to 0.33, which is slightly more than 81,000 per month now. And for individuals, they are going for higher position. So we do have some senior positions in hospital authority and in other NGOs, and also in selected organizations such as ADB or in universities. And then you can see that some position, they can be up to 0.44, or there are some also more senior position that is beyond 0.44. So if you're interested in how much salary you're going to make, then you can make reference here. And also, I think you may be interested to know that what will people see if you're graduating from PolyU? We all know that Hong Kong U has bachelor's degree, CUHK has a master's degree, and PolyU and ADU will have both master's and bachelor's degree. So how will people see our graduate? So by now, we have been running this program for more than 10 years. So I think we can confidently share with you some of the comments from employers and different places, like from Education Bureau, they know our alumni working in schools. So for other NGOs, then they may be working in preschool or in elderly settings. So they all hire our graduates. So I can say that our graduates are very much welcome by a lot of employers, and they have been quite much popular choice among employers. Now, Dr. Leung talked about our overall curriculum. So here is a little bit of snapshot of the clinical education curriculum. Like we mentioned earlier, students will have clinical placement in the first semester of MST learning until the final semester. So you may be starting to get a bit worried, isn't it? So when you are coming to study in September if you are getting admitted. So you will start in September. And actually your clinical placement also will start in September. But don't worry too much about it because there will be a progression of clinical education. So for a novice, very early clinical placement, we do not expect a lot from students. So that means that you will be working under a lot of assistance, either by some material we give to you or with the help of your clinical supervisor. And of course, I would not say that MST is an easy course. It's not an easy course. It is very competitive and it is highly, how to say, I won't say that it's very difficult, but it's highly challenging, I would say that. Because I think most of the people, if you are thinking about a bachelor's degree, is using like 4 to 5 years to train a person from novice to a professional and entry level. If you're working with a master's program, that means here you're working with us 2.5 years, then you would become an entry-level speech therapist. So it is not that easy. It takes our effort and your effort in order to get successful. So as you can see, there are different components. From CP1, we will have a little bit of observation, and then you will be working under our supervision with a more structured program. By CP7, if you can see, then you will be working with a mixed caseload and a lot of external setting. Like for this year, and our student will, each of them at this period of time, which is like in November, September to November, they are actually going to 2 different clinical sites. So maybe Wednesday, a student is going to a kindergarten, and Thursday is actually going to an OH home to work with different populations. So it is indeed it's a bit challenging, but this is also our way of progression to make sure that students are actually practice ready, because you think about November student doing placement, but in January they are actually a qualified clinician, right? So from CP1 to CP7, so there will be more than 300 hours of supervised clinical practice. So you work with different colleagues, both from PolyU and outside PolyU. And this is our speech therapy unit, and it is located in the EF wing of PolyU. So if you're interested to see what is inside there, so I very much encourage you. You can sign up to our January seminar, info talk. So that info talk will be conducted in Cantonese on campus, and you will have a chance to talk to colleagues and our students, and you can take a look at the setting here at STU. So STU serves different purposes. We provide clinical services. We actually have 2 full-time speech therapists working here to provide services to the general public of Hong Kong. And it is our education hub because we have some clinical placement which is conducted inside there. It is also a research hub because our colleagues will conduct research there. They will collect data there. They will work with some more fancy, interesting idea that are still in development, because this is in a way that we will be able to generate some idea to facilitate better clinical practice in our profession. And these are the rooms available in a speech therapy unit. So you may be seeing that we don't have a lot of fancy equipment, not like physiotherapy, right? However, because we are working with speech and language in general, and speech and language are very much in our mind, right? So it is not something that we don't use a lot of equipment, but we do have some equipment there. So students will have opportunity to learn to use some equipment which is relevant to our clinical practice. And here you will see that actually the room you're seeing here is basically the room in the middle. It's our video review room. You see a lot of computer there because the student, after doing their clinical placement, will record their sessions so that they will be able to review what they've done. And then also, sometime we will get them other clinical videos so that they will learn how to do clinical placement better in the future after reviewing the performance of what happened. And we also have some meeting room and other facilities to help our students to acquire the necessary skills to become a speech therapist. And we also have clinical placement in different places. And then you can see that there are some children settings, younger children or older children in the mainstream school. And during the time of COVID, and then we also develop a little bit more telepractice. I will not say that telepractice is replacing a lot of face-to-face practice in Hong Kong, because by the end of the day, we are not like a large country like the United States. People have a lot of commuting issues. So I think a lot of our clients, they will still come to clinic to see us physically. However, we do work with telepractice for some other cases. For instance, sometimes our student will work with clients in Macau, and then they would like to seek service from us. And also we also make use of face-to-face and telepractice interchangeably. For instance, sometimes there's some client, they are a little bit unwell, maybe they have a flu, or some adult client, then they may have the family member, they have sudden issue, unable to accompany them to the clinic. And then so we can immediately switch them to telepractice, usually through Zoom. And then it will be pretty convenient actually for the clinician and for the client as well. So I think it's something that it's not a sad story for we suffer from COVID-19, but then we still earn something. And we also work with elderly in residential care facilities. And also, one of the uniqueness of MST program is that each of our students will undergo 15 hours of clinical practice in China. So as you can see that we will work with different facilities. Some are maybe children facilities, and some are adult facilities, and some are more, they will have more disabled children as well. So our student will have the opportunity to see clinical population in a different places. For instance, there are certain clinical population that you can see more in China in general than in Hong Kong. For instance, cerebral palsy cases, and also a variety of cases with hearing impairment, like that. And then another way is that we would like to have our student to be trained to be advocate of speech therapy for our for the Chinese speaking population in general. As you know, then China is a big place for Chinese speaking population, and then generally the speech therapy practice in China is less regulated, and then training is also very much scarce. So a lot of opportunity that we will have. We can, as a teaching team, and then we help some of our Chinese partners to develop their service. And also for our students, they will have opportunity to engage in this kind of professional consultation activities, in addition to seeing cases in different dialects. So very interesting. Usually we go to one clinical placement site, and then we may be able to use Mandarin Chinese, Cantonese Chinese, plus some other dialects. So I think our students are pretty smart. They can change the dialect, and I can find out that some of our students actually, they can speak the Hakka, Hokkien or Teochew, and then different kind of dialects. So this is a challenge actually clinically, because I think the very few people are actually trained trilingually or quadrilingually. I think it's a little bit more than bilingual. I need to ask the expert here, but I'm bilingual. James is an expert here. And we, of course, we are very much indebted to our clinical education partners. So we have partners. These are some of the partners they work with in Hong Kong. And when you consider why PolyU, I think another way to think about is that PolyU is a university with a lot of applied sciences here. Applied sciences, for me here, I refer to a lot of health sciences professional here, actually. So we have opportunity to work interprofessionally with other colleagues, for example, PT, OT, or even sometimes optometrists or biomedical engineering colleagues. So it is our goal that we will be incorporating more of this collaboration in our teaching going forward as well. And like Dr. Lam mentioned earlier, we are housed in the Department of Chinese and Bilingual Studies. So we work with a lot of our linguistic colleagues. And then if you talk to our MST students, they will tell you that like the colleagues teaching them phonetics and phonology is a very experienced person in linguist in that area. And then we can actually have direct contact with him, and then we will discuss how to teach in a way that we can transfer these skills in a clinical use. So this is something unique that we don't just find anybody to teach because they are our colleagues in this department. And our in-house clinic here, I already mentioned that we have a lot of different cases, and we will have also speech therapy colleagues telling us that what will be the most expected way of working actually, or the caseload differences over time development. So we will know that what will be the best way to prepare our students for work. And in general, we have a very stable teaching team. I think we have the largest teaching team in Hong Kong in speech therapy. And we talk about, we have a large team of professorial team, and we definitely have the largest clinical education team in Hong Kong. So if you have joining our seminar before, you'll probably find out that the slide has been changed. I changed it to 100 years of experience to 150 years of experience. I didn't grow all 50 years by 1 year, but then we actually hired more colleagues. And then the colleague we hire, and then they are of different clinical expertise. So we usually hire colleagues that, because we have researchers, they may be very focused on research for many years, but then we also hire clinical colleagues that they will have different type of clinical practice and in different clinical populations. So in a way that it can enhance our teaching. So this is some behind the scene, and then not too funny. And then the funny thing will happen here. I will not show you, of course. And you can see that, for example, the single-sided observation, and then we will have educators and students together. We will look at how the other students are doing, and then sometimes we'll review the session together real time. Just like you see down there, you see that we use iPad, that we actually have supervision going on, and then but we have other students that they don't have case at the time, and then they can discuss with the supervisor. So this is in a way of learning as well, because clinical observation is a very important tool to facilitate the development of clinical skill. Because sometimes when you're in a clinic room and then you are a little bit worried, or you're a little bit narrow focus, right? So this kind of observation is also important in addition to observing yourself through the video afterwards. And you can see that PBL in action. So we have students, then they will be discussing actively. So in PBL learning, tutors' role are more passive, actually, because students are the active learner. So they will think about what they want to learn, and then they will use different ways to acquire the skills. For example, I think we're doing concept maps and the photos there. And also, of course, the tutor will help on the way in order things go wrong. So we have to ensure the student will acquire the necessary skill. But think about it, when you go into clinical practice, then you can't ask your boss or your supervisor all the time for what to do next, or for when we are encountering a very difficult cases. So PBL is the way that we equip the lifelong skill in order to solve problems clinically later. And there are some also teaching and learning plus. And then, so we have some graduation time. I think last week we also have our congregation of our last batch. And on the left, you can see that these are usually after clinical placement. In the middle of clinical placement in China, they usually focus too much on preparing. They won't be having that kind of a lovely smile. And then this is by the end, the smile will get a little bit more lovely, right? And we also have other activities. For example, we have some very helpful alumni. Then they will be offering, for example, some career planning for our current students. And sometimes we will also have other community that we would like to engage students to do. And going forward, I hope that we will have also other more visiting opportunity, either go to China or some other places, because we see that there are different things that we can see. Also, we also learned something after COVID. Now, I think there are some other development we would like to show you. And also, In addition to a challenging curriculum, I think you all probably would know that in a slide presented by Dr. Le earlier, and then a postgraduate self-financed professional program is not cheap indeed. So depending on whether you can have some credit transfer, and eventually I think most of our students will have to settle a tuition fee of more than $500,000 Hong Kong dollars in order to complete this program. And our department also offer postgraduate scholarship, and the scholarship is like this. You don't need to apply. You are automatically enrolled in this program. So very good. You don't need to write a lot of whatever long statement or go through a lengthy interview process with us to impress us. You don't need to do that. You just need to be a student of MST, and then you're automatically enrolled in this selection process. So students will be selected according to their GPA, which is their study performance, and also their clinical practice performance. And there are 10 scholarships per cohort year, so it's quite a lot. Think about our first year right now, we have 31 students. So actually 10 out of the 31, they will be able to get this scholarship. But of course, they need to settle the requirement, fulfill the requirement. We talk about the GPA and the clinical practice requirement. So in a very unfortunate situation, if their GPA is very low, then of course they cannot get the scholarship. But then maximum we can do 10 scholarship, and each one of them will get 40,000 Hong Kong dollar per year. So first year is like this, and second year, and then we are back to zero again. So you can work hard again to see whether you can be the top 10 in the class, and then you will get, if you're successful to get the scholarship, then you'll get 40,000. So, and if you are so lucky, then so successful in these 2 years, so in total, then you will get $80,000 for this scholarship. So in total, you can say this about 14% of the total tuition. So for the final year student, you don't get this scholarship, but then final year student will get a CBS prize for distinguished postgraduate student in our MST program. So it's according to our GPA, your final GPA. So it's ranging from 3,000 Hong Kong dollars to 10,000 Hong Kong dollars. So this is something that usually we are very happy to give away in our congregation, the graduation ceremony. And for credit transfer, if you're being admitted, and then later you can ask our general office for the detail. So basically, and then either you have been graduated from PolyU for certain, you enroll in certain subjects. So we have certain credit transfer facilities available. And then if you're graduating from other university, then usually the equivalent transfer will be from master's level. Master degree programs. But for the details, I think you can find out more once you get admitted to this program. And also, usually I would also remind our prospective student here, our MST study will not start in September. So usually the semester will start in September, but then the last week in August, you should be prepared to start your program. So we will have an MST orientation day by the end of August, which is important that all the admitted students, they have to participate. If you're not participating, then you will miss a lot of information. So basically, we will say that this is a mandatory activities that everybody will participate, and then you will be able not only to meet us, colleagues, teaching staff, you'll be able to meet some of the current students, and then so that you will have some connection with them, which is also important. Students told us that it will be important for the survival, particularly for the first month of the study. And then later, I will pass the time to Angel, then to be talking about some entrance requirement of our program.
Thank you, Janet. Good evening, everyone. So this part is rather short and factual. So I'm going to go through this quickly, short and sweet. Now, please be reminded that, as Janet has mentioned, the video recorded session this information session will be uploaded on the web, and you will also have a copy of these slides, so you don't have to take specific notes. So entrance requirements, the first will be that we do expect a bachelor's degree from a recognized university, since this is a master's degree. And preference will be given to applicants who have a bachelor degree in these disciplines, supporting disciplines, and highlighted in blue, and these include linguistics, psychology, speech and language sciences, medical or health related disciplines. And this is because if you take a look at the 6 points here, which list the kind of structure of our program and the distribution of credits, you will notice that the study of speech therapy will involve these disciplines as the foundational supporting disciplines. So we do believe that if students graduate with relevant training in these supporting disciplines, they would have an advantage when they step up to do a master's degree in speech therapy. Now, having said that, we also need to clarify that if you are not bachelor degree holder of these disciplines, but you believe that you are above average in academic abilities, don't be discouraged. We do encourage you to still apply, because we do have a number of graduates who did not have a bachelor degree, relevant training in these disciplines, but still be able to thrive and did very well in the Master of Speech Therapy program in their study. Okay. Right, so this slide is rather straightforward, and it details the entrance requirements for English proficiency. Since this is rather factual, I will not read through all the bullet points. So basically, you need to satisfy one of the following requirements. You see it's or, right? So it's one of the following requirements. And we also add the equivalent, okay? So you see the last bullet point, the equivalent. For example, CRE, use of English level 2. So we do recognize that. And do pay attention to the validity period of the TOEFL and IELTS results and how this is counted. And please note that IELTS and TOEFL online home edition are not accepted. So in general, we would expect applicants to be able to communicate verbally in English effectively. The next slide is about Chinese proficiency. Again, applicants would have to satisfy one of the following requirements. So it's also an or statement. And under the last bullet point, the equivalent, we also specify that we do recognize CRE, use of Chinese, level 1 or above. And please note that UK IGCSE A-level Chinese results are not recognized. Okay. And do pay attention to the validity period of HSK and SHSK results. It's about 2 years, and we do give a 3-month grace period. And please pay attention to how this is counted. And we do expect that applicants should be able to communicate verbally in Cantonese effectively, and that proficiency in Mandarin is preferred. So regarding SHSK, this is kind of basic information. However, we were informed by PolyU, the Chinese Language Center, that this exam has been suspended. So applicants can choose to apply to take HSK instead as an option. So this is a slide about HSK, and duration is about 140 minutes. And we also stated the requirements in terms of the scores. To go to the website there, we put up a QR code so you can have a look at the test dates and further details of this exam. Right, other entrance requirements include a personal statement that can address these 3 points. The first point is about your understanding of speech therapy and your commitment to speech therapy as a career in Hong Kong and or mainland China. The second dimension will involve how your previous studies and experiences support your application, highlighting particular relevant study, work, and or personal experiences that are related to speech therapy. The third bullet point is about explanation of any other factors that the admission panel should consider for your application. As for length, it will be around 800 to 1,000 words in English. We do, although this is stated as optional, but we do highly recommend that you would include 1 to 2 recommendation letters addressing your qualifications, relevant working experience, and other achievements. Right, points to note, please upload all supporting documents via e-admission. So you would see the list of supporting documents highlighted here. Normally, application will not be processed unless with full provision of supporting documents. But what about current students with expected graduation in this academic year, 2024-2025? Now, of course, you can definitely still apply. And if you have expected results of your language proficiency test, and these results are to be released, you can state this clearly, this information clearly in your application documents, yeah? And you may still apply without full provision of relevant documents. However, you should provide proof of your study status for your bachelor's degree and or documents showing the date of relevant language proficiency tests. So we do know that there is evidence that you have already signed up for the relevant language proficiency test. Okay, so that's my part, and I will pass it on to Olivia. Thank you.
Okay, thank you, Angel. Hello, everyone. I think you're all very eager to know more about the tips to prepare for the interviews. But before talking about the tips, let me show you some data. This is the MST historical admission data. As you can see from the pie chart, majority of the students that we admitted in the previous 12 years are mainly from the institutes of Hong Kong, and around 17% are from overseas institutions, and another 1% is from Greater China institutions. I think it's something expected because as an ST working in Hong Kong, we need to speak Cantonese, Mandarin, as well as English. So it's normal to have, we admitted students mainly from universities in Hong Kong. And then another piece of data, this is the pie chart showing you the background of our students. At what Dr. Andrew Chan just said, our students are mainly from several disciplines, including like linguistics background, psychology background, medical and health, as well as speech and language sciences. And but what I want to highlight is that, of course, those students from these backgrounds has advantages, and we tend to, or we have the preference of admitting them. It doesn't mean that we don't admit students from other backgrounds. For example, here in the pie chart, you can see there is 3% of students that we admitted. They are from business background. It's something unexpected, right? I think we admitted them because they have the quality that we are looking for. So here are the quality of somebody we are looking for. We are looking for someone who are prepared and who have the quality and determination to become a helping professional. First of all, students should have academic and intellectual competencies to support the theoretical reflection. As you all know, as an ASTI, we need to learn a lot of theories, knowledge, and to apply the theory to practice. So academic and intellectual competencies are very important. And of course, we need to have appropriate aptitude and attitude. And then the third one is the language abilities, as we are catering patients with communication disorders. So language is something important for our occupation. And of course, it's better to have relevant experience. And we hope to find someone who has the potential impact to the profession. But honestly, it's difficult for us to know whether someone has the potential. Yeah. And then the last one is very important, the stress management capabilities. As what you know, MST program is a very packed program, and students will have a lot of work to do, including lectures, PBL tutorials, as well as CP clinical practicums. And every day are packed, and they don't have much time to rest, honestly. And from time to time in the clinical placement, students will receive comments from clinical supervisors. Some comments are positive and some are negative. So it's very important to manage stress appropriately. So this is someone we are looking for. And then here I show you something about the quality of an ST. On the right-hand side of the slide, you can see 3 arrows showing heavy workload, continuing professional development, and job satisfaction. I think this is the life of an ST. No matter which setting you're working at, STs have heavy workload every single day. And because we have to cater cases, they are new to us, we have to learn like taking courses and read books. And after doing all these, we can get this job satisfaction because the improvement of our clients is the origin of the job satisfaction. And here you can see there are some quality of the SDs, and I don't read them out all, but I would like to highlight some of them. The first one is the sincere interest in helping people. Speech therapist is a helping profession. The goal is to support and to help patients with communication disorders and or swallowing difficulties. So it's very important to have sincere interest in helping people. Otherwise, it will be very difficult to continue with this career. And the second point that I would like to highlight is the commitment to work cooperatively with others. As we work in different settings like hospital, special childcare centers, special schools, elderly homes, and a lot more. And we will see different professions. We work with them, like doctor, nurses, social workers, teachers, and even chef. For example, if we work in an elderly home, OH home, because we have to prepare a meal for the elderly who have swallowing disorders, then we have to work with the chef to cooperate with them how to prepare the meal. So it's important that we need to have the commitment to work cooperatively with others. And then the last one is the attitude of embracing challenges. Every day we face challenges. We have new cases, and sometimes we prepare the treatment for a client. Maybe it doesn't work. These are all challenges for us, and we need to have the attitude of embracing all these challenges, and we have to see them as a way or as a step or as an opportunities to improve and to excel. Okay, here, the admission interview. I think this is the most important part of today. So the interview includes 2 parts. One is the group interview and the other is an individual interview. The group interview will last for 15 to 20 minutes and is in English. Here, you can see from the bullet point that we mark it as PBL taster. We arrange in a way that is similar to the PBL sections. At the beginning, we will provide you with a PBL problem, and then we provide some information for you to read. And then afterwards, you discuss with the other applicants. And of course, there will be an interviewer observing the performance of all of you. And then the second part is the individual interview. It also lasted for around 15 to 20 minutes and it's in English, Cantonese, and Mandarin. Of course, we want to know whether you can speak fluently in all these three languages. And the goal is to get to know more about you in person. We will ask you some questions in different languages, and we will provide you with some scenario to see how you solve the issues. And here are some interview tips. So first of all, be yourself and be genuine. There's no need to pretend to be someone else. And as what I said, we will ask you some questions. There's no need to guess what we want you to answer because we, as interviewer, we don't have the standard answer in mind. So just be yourself. And of course, as you are enrolling in a professional program, please make sure that you have background information on speech therapy, such as the scope of clients and services available in Hong Kong, as well as the potential future development of the profession. And then the last 2 points, dress professionally, either in person or on Zoom. I think it's not a good idea to dress like wearing t-shirts with jeans. And the last point, very important, please be punctual. As an ST, it's very important to be punctual. We won't let our clients wait outside our clinic room. And if you are not punctual, if you're late, it's very difficult for us to arrange another time for you to do the interview. And here's the timeline. And MSD admissions operate on a rolling basis, but please do apply early. And for the shortlisted candidates, we will invite you to join our interview. The interview will be held in person, or for those applicants applying from outside Hong Kong, we will provide Zoom for you to do the interview. There will be 2 rounds. The first round is on the 10th of January, 2025. And at that moment, we consider applications received before 16th of December, 2024. And the second round is on the 19th of March, 2025. And we consider all applications. It means that if you apply before 16th of December and you don't receive our email or call about the interview, please don't be disappointed because you may be invited for the second round of interview. And please be reminded that no makeup interviews could be guaranteed for applicants who failed to attend the scheduled interview. And the applicants will normally be notified of the admission results no later than April 2025 or until all places are filled. Okay, and the application should be done through e-admission. Here's the QR code, and the deadline is the 28th of February, 2025. And if you have any queries about the online application system, please contact the academic registry. Here's the email and the phone number. And we will upload this slide onto the internet on our web. So there's no need for you to copy down all these. And as what Dr. Angela Chan just said, these documents are required, including the bachelor's degree transcript or certificate and 2 proofs of language proficiency. One English proficiency proof and the other one is the Chinese one. And also 1 personal statement in English of around 800 to 1,000 words. And of course, if you have a recommendation, 1 or 2 recommendation letter, please do upload together with the other required documents, but it is optional. Okay, and this is what you will see on the slide. I am not sure if you can view them. On the left-hand side, what I want to say is the middle one. The middle one is, you may see on the e-admission on the top right corner, you will see the words application being processed, and the other one is on waiting list. So the system only wants you to know that your application is being processed. It doesn't mean that you are accepted or you are rejected. So if you see these words on the screen, it means that you may or may not be invited for an interview, and you may or may not have completed the interview. Okay. And then this is the summary. So please check if MST is suitable for you. First, MST is a full-time master's degree of 2.5 years. And we are a speech therapy curriculum covering full scope of service. And we use hybrid approach of learning through lectures and problem-based learning. And we provide more than 300 hours of supervised practice. And our clinical practicum prepares graduates to practice competently in various clinical and educational settings. Of course, our teaching team believes in students' ability to excel. Okay, here comes to our question and answer part.
Yeah, so for those who join us slightly later, you may have not heard of me talking about this. So you're very much welcome to type your question in the chat box. And if you are willing to talk to us, you want to ask your question verbally, then you can use the raise your hand function, and then our colleagues will notify us, and then you will then be unmuted, and then we can answer your question. So in the interest of time, and then we have collected some questions from the audience. So we may just answer some of them first. Maybe those can already resolve some of your question in mind. Maybe Angel can start some on this.
I think we can stop sharing the screen, right?
Yeah, it's okay. But we will have the final two anyway. So we can leave it here. We can leave it like this, I guess. Yeah. So yeah, you can show that.
Okay, yeah. I've got two questions. One is about confirming the English proficiency requirements. And question was level 2 in CRE, use of English section. If the applicant got level 2, does it meet the requirement? And the answer is yes. We've stated that as the equivalent. Okay. The second question was about research project. And the question was individual based or group project. The answer will be we have both that can coexist in the same cohort. And that's because it depends on the nature of the topic and operational needs of the operational needs of that project for that time frame. So to elaborate a bit more, for the group project, it's common. It's rather common, and the idea is that students may pair up, or they may be working in groups of 4 or 3 or 4. Okay, on a topic. But then they may be responsible for different dimensions. And in the end, although they work in a group, in the end, they still have to write up and submit a research proposal and a research report individually. Okay? Now, for individual based, it is also possible. For example, it could be that for a topic, for a particular topic, because of its nature, and because of its operational needs, that time frame, it is feasible and adequate to have only one student working on that topic. It is also allowed, or it happens. So we have both. Yeah. Okay.
So there are some clinical practice questions. Dr. answer one of them
Okay,
first.
the question is clinical practicum arranged by MST or by student themselves? The answer is that it's arranged by MST because we have take full responsibility for the clinical practicum and make sure that you have enough clinical hours across different categories. So, so you be safe. I mean, under our care.
Yeah, I think to follow up what Dr. Lan just talked about, another question is about are cases with hearing impairment common, and any advantage if I know a bit of sign language. So I was saying on top of what Dr. Lan just mentioned, if you see the scope of service, in general, most ST training program, the clinical placement arranged by the university will cover both adult and children placement. And in addition to that, of course, that will cover speech, language, swallowing, and that it will be doing assessment, you will be doing therapy, treatment. In addition to that, there are a couple of specialty placement in MST. there's one reading disorder placement in year 1. And then by the end of the year 1, the start of year 2, student will have an oral rehabilitation placement. So I will talk a little bit more hearing impairment a little bit later. And then student will also have a China placement, and also we will have one voice disorder placement and one fluency disorder placement, and we call this specialty placement. And in addition, we also added one community swallowing placement as well. So in OHM. So in short, to answer that question, if you know sign language, would that be an advantage? It's always an advantage to know whatever language, so including sign language. However, for those who doesn't use or know sign language, and you are not at a disadvantage, because first of all, not all hearing impaired cases, they need to use sign language. And secondly, if we are talking about Hong Kong and China, and then if we are seeing cases, basically across border, different there are different sign languages to be used. But in short, that's the answer. And another relevant question is that if there's any alternative, if a student is unable to do a clinical placement in China, the answer is no, actually, because this is part of the requirement. And then we assume that's why we will usually tell students early. If you are a passport holder and then you need a visa to enter China, we will tell students ahead of time, and usually they will be able to arrange such. And if you need homegoing card and then you have never got one, and then usually we will start to ask you to get one, and then when you are admitted, and then so that we will arrange clinical placement anytime when you're ready. And the other question is about this one for Dr. Leung. We have so many questions, and we always run that way. We like this kind of paper thing.
We love questions.
Yeah. And usually we answer questions for longer than the talk, but we still need to deliver the talk. That's the point. About any scholarship or sponsorship for the application, we do not have entry scholarship. That means we do not have some scholarship. Okay, if you're being admitted because of your academic merit or whatever merit, we give you such an amount of money. We don't have that. We only have the scholarship, which is progressive within MST. That means you need to complete your first year, complete your second year. At that time, you already pay your tuition anyway. And then so you will get the scholarship. And any scholarship offered by NGO, just like our other program in PolyU for Master of Occupational Therapy or Master of Physiotherapy. And there's no such scholarship. I tell you a little bit more about that because in general, in OT and PT, NGOs historically has always been having difficulty in hiring PT and OTs in NGOs. However, in speech therapy, actually, the majority of speech therapists are working in NGO, and ST actually, I can say, actually love to work in NGO. So NGO, they still have some hiring difficulty, but they don't have very serious hiring difficulty. And that's the same reason why SWD will have that kind of arrangement with MOT and MPT training, and there will be no such arrangement for ST training. And I don't think there will be the chance in the future due to this difference in the kind of employment market. And for the tips for PBL taster in the interview, so what to do in that and how to prepare. So actually, you don't quite need to prepare. So this is the point of that. It's a taste. Don't worry about it. We actually see that there are prospective candidate students, then you have a little bit experience. For instance, we see candidate working with maybe children with disability, SEM before. And then they come, if they have advantage, I would say yes and no. Yes, sometimes they do have some real life experience to share or to supplement the discussion among usually, I think, 8 to 10 students, right, most of the time. And however, you are not going to dominate the discussion because dominating a discussion, you don't know the exact marking scheme, but you won't get a lot of marks in any group discussion, right? If in that way, because you're not respecting the group environment. And the other is how is it be done? Usually, you will be given an abstract of a research article. That's why I said you don't need to prepare, because actually I don't know what kind of research article we are going to use, because we will have a team of colleagues who design this year what kind of article we are going to use. And we do not have exact expectation on what kind of, for example, the learning issue you need to discuss or the topics that you need to talk about. And you don't need to really worry about it. I think it is more about it's fair that everybody got you will review that abstract. You have a couple of minutes to read through it, and after that, everybody will engage in a discussion. You're not being rated by the content, because we do not expect you have subject knowledge before you go for MST study.
Right.
Otherwise, you don't need study. And however, we want to see the dynamics of discussion, and also we want to see whether you can discuss things in a coherent manner, whether you can organize your thoughts and put it in speaking. I think my only tips there is that you have to speak. Every year we talk about this, and every year there may be some candidate you're too shy to start, or you don't know whether you should start that time. By the time you know that you should start, and then time is up. But then you will be given the time. You will know what time, how much time is left, so that not to fight with others to speak, but that you really need to speak. If you don't not speaking at all, how can we actually rate you in that group interview performance? You will definitely have 0 point from group interview performance, right? Yeah, maybe I pass some of the questions first, and then Dr. Leung got a question there, right?
Other questions about any age limitation for the course. The simple answer is that no, and that's why we have MST. But the issue is that we have experience of students in their 40s coming in. We have admitted them, and they find it extremely difficult to go back to student life, especially their colleagues are much younger than them. And when they study together, they find a lot of difficulties. I urge those in that category may have to give them a second thought, see whether you are able to cope with this kind of situation. If you are still confident, I encourage you to apply.
It's more your own readiness, I guess. And we also have other example that we do have students that they are a little bit older than the other student. Of course, you could expect that. I think in general in Hong Kong for postgraduate study, that particularly in postgraduate study, and majority of the students are relatively younger. We have a lot of fresh graduate coming to study. We also have some young souls, then they work for 2 or 3 years, and then they want to come back for study, and then they want to change their path like that. Those are the majority, to be honest. However, we also have students that they are a little bit more mature, and then our student we have successful cases. They can be successful, but like Dr. Leung mentioned, I think it is challenging. It's not because of age. I think it's because of the experience that you have, and also your expectation and your readiness to go back to a full-time student life. And I think I see our student most of the time is after office hour in library. I don't ask what time they leave, but then I just know that they're there all the time. You got something.
Okay, so I got 2 questions. The first question was about any advantage to do the first round interview. Well, the obvious advantage would be that if you're qualified, you would be able to secure the offer sooner.
Yes, so
So
apply
that's
early.
That's the most obvious advantage. The second question was, the candidate didn't take Hong Kong A-level exam, but had a grade A in HKCEE exam. So I suppose he was referring to English or Chinese proficiency, yeah? And the candidate is a bachelor degree holder. So the answer is yes. So we do recognize HKCEE results, English and Chinese results. And if we get a grade A, that's fantastic. So we do recognize that.
Okay, Olivia, have some.
Yeah, I have some questions about the application. The first one is do I need to have the reference letter from former employer? The answer is no. The reference letter can be from your former employer or from your former teachers teaching you the bachelor degree. And it can be someone who know more about you and they can tell us your quality. So it's not necessary to be former employer. And there's a question about written test. An audience asks, is there any written test before the interview? The answer is no. What you need to, during the application through e-admission, you have to upload a personal statement in English, but there's no other written test before the interview. And then there's another question about online interview. Because you have a full-time job and then you ask whether we will offer online interview section. The answer is no. Online interview will only be offered to those who apply from overseas.
So I also have some, I have two questions relevant to volunteering work. One of them is that any volunteer work related to ST that I can apply. If you're talking about how to prepare for application and interview, then of course, then you could feel free to be in touch with some either non-government organizations or some other self-help organizations or even some other private organization. Of course, it's not very easy because I think just like Elisa mentioned, I mean, we are having heavy case, so that means actually a lot of ST clinic, they're pretty busy. And then it's not very easy, I would say, but then year on year, we actually see a lot of people, they actually got this kind of volunteering opportunity. In addition, I think that sometimes not really volunteering at an ST clinic that matters. I also see applicant, they actually did volunteering at a PT clinic, or even then they will go with some groups running by social worker. They just want to gain more experience to work with children. Because actually, I think the experience that most of our students, apart from the time they were a child, a lot of students actually, you haven't been working with children for quite some time, unless you have a really young brother and sister at home. However, most of the people, actually now we have a little less children now, most of the people, they all forgot how children time is like. So actually, if you have opportunity to even volunteer at events targeted at children, those are actually very helpful, I think, and it will help your placement actually in the future. Yeah, for elderly as well. Even you just go for OH home visit, you talk to them. I think it's very relevant. We even work with a lot of elderly cases, and sometimes we see our student actually told us a couple of months ago, they don't know how to talk to a person.
They don't know how to talk to. During the training, we ask students to interact with their grandparents. And this is one of the assignments. And students found that it's very difficult for them to interact with their grandparents for more than 5 minutes because they don't have topics to talk with them.
Yeah. So that's one of the story and real, right?
Yeah.
And the other is any volunteering work will be arranged by the department to know the working environment of ST and gain a slight experience. It's like this. We actually have some arranged observation opportunities. Quite some conducted in year one, and there are also some ad hoc opportunities. Sometimes we will have some organization that we will offer those opportunities. It's not exactly volunteering work, but it's a small clinical observation that is usually a more integral part of our training. And the other is actually when students enrolled in our program, there are a lot of NGOs and they will send email to us teaching team members. Sometimes they will look for volunteers. They actually specifically look for ST students to be more volunteer. Of course, sometimes they want to look for maybe year 2 or above, more advanced students. And then those ones that we will usually share the information through our general office to all students by email. And sometimes we will also share the information using class reps. And a lot of students will actually apply according to their own timing, their own engagement, their own schedule. So there are some. And for clinical placement, any overseas clinical placement available currently is no. The reason is that MST is a very packed program. Honestly, we are exploring this opportunity for our bachelor program ST student. However, year on year, as you see that we already admitted 12 cohort of students, we have like 10 cohort of students already graduated. The issue is MST, I need to tell you early, MST does not offer summer vacation. So basically, once you sign up this MST, you'll keep doing it every month until you graduate. So we can't arrange overseas placement that easily by a compact program, very packed schedule. So that's why we can't offer that. Yeah, so you ask except for China placement. And I answer one more before I pass on to colleagues. And for any difference between ST, they are graduated with a bachelor's degree or a master's degree on the salary, experience, etc. Is MST more competitive? I would say no. Actually, in Hong Kong and in elsewhere, we call entry-level program. In Chinese, we call 准入課程. Basically, you are the basic standard to enter a profession. So no matter you are graduated with a bachelor's degree or a master's degree, you are kind of equal in when you go for a job interview. I can share with you because before I joined the university, I have been an employer and I interview a lot of people from Hong Kong and overseas. However, I think an interview or to secure a job or not, it is really on individual merit. If you talk about whether you have previous work experience, whether it will help or not help, it also very much depends on individual merit. So that would not change your starting pay, your starting salary. And also come across some candidate, they actually had a pretty senior position before they start their ST study in Hong Kong. And after they graduate, so their senior position in other area, I would say that experience would not help you to secure a higher starting salary if you join the ST profession. This is what happened in general. And MST is more or less competitive. So that's why I can't say that way. I can only say that with the facts that I have. So we have students, and a lot of students, they could be competitive when they want certain jobs. There are certain jobs in the profession, they are particularly competitive to get a position there. So I would see that in those organizations, our students have been quite competitive. They can get a job, and a lot of them can survive in that environment. So that's just one thing that I can share with you.
Okay. I have a question here asking whether an independent or team player is more preferable in ST profession. My answer is that we need both. Okay? Actually, in the program, we have assignment and we have a situation where you can show that you have the independent ability and you are actually a team player. Actually, the more adaptive you are, the more flexible you are, the more welcome you will be. And we train you to be an independent thinker, and at the same time, we train you to be a team player.
Okay, so I've got another questions. Before I start answering them, let me maybe we can add a clarification remark about the summer holidays, because Janet may have intimidated some people, saying that there's no summer holiday for MSc students. It's true. So don't expect you have 1.5 months or 2 months of holidays. But having said that, our students do have at least a week off. I should say, yeah.
But we
Yeah.
have Christmas holiday.
And we have Christmas holiday.
We have,
We have summer holiday.
we are going to tell our year 2 students that
Yeah.
we have 2 weeks, right? For
3 weeks.
3 weeks
Yes.
of Christmas.
So it's very humane. So some questions about IELTS. To clarify, IELTS exam needs to be taken within a certain period of time. Yes. So we have stated that in one of the slides, and that's about the validity period of IELTS results. Okay. And so basically, the validity period will be 2 years, but we add 3 months as a grace period. So that would be 2 years plus 3 months, as the validity period. And how to count that? It will be, you count from the date of your test results, release date, and till the 27th of November, 2024. Yeah, we put it down in one of the slides, so you can refer that. You can refer back to that slide when the slides are loaded onto the back. We have also stated that the home online edition, okay, if you take IELTS, and if it's an online home edition, that is not accepted. And that's because we're following the university guideline, all right? So that's something we want to clarify again. And another question about research project. The question was, research project is our own choice or assigned? Now, the answer is it's both are correct because our current practice is that we would, so students will start taking the research projects from the second semester of the second year till the end of the MSc period. Okay, so roughly that will span across around 11 months. And we would, in preparation for students' research projects, we would announce a range of topics, research topics, okay? And that would range from around 15 to 20, research projects for students to choose from. Okay, and then you have chance to meet up with prospective supervisors, get to know and be exposed to a broad range of topics. The basic information about the project for your consideration. And then you will need to fill in an online form to indicate your first 6 or 7 choices of topics. Yeah, so we do take into account students' choice, the preference. And then the MSD research project coordinator will then assign the matching between student, topic, and supervisor, right? So we do accommodate, so in the past, we have been accommodating students' preferences, first 6 to 7 preferences. But having said that, of course, not all students can get the first choices because topics do range in their popularity. So it's possible that too many students would choose a particular topic as first choice, and that's not feasible to accommodate all these students to work on that particular topic, and therefore we will have to assign students based on their maybe second or third or fourth choice. Yeah. So the short answer will be, we do consider your choice, but it's also assigned. So both. Right. So there's another question about HSK exam, and the question was that does the applicant need to include the HSK speaking exam as it is a separate part? Yeah. Now, according to our recollection, the speaking exam, it's a separate part that doesn't need to be included. But I think to play safe, it's best for you to please email our admin colleague, Mabel Tong. So you'll find her email address in the last few slides to double check with her. Okay. So she's the one who knows what's the exact details. Okay. So do double check with Mabel. All right.
Yeah. So I have some question here, and one question is on the dropout rate of MST. We don't have the exact dropout rate here, but I can share with you in the last three graduating cohort, more than 90% of the students graduated on time. On time means that they're entering year one, and then they go through 2.5 years of study, and then they graduated. So that is called on-time graduation. So in the last 3 years, we have more than 90% of on-time graduation. And any applicant from China was admitted so far. If I recall correctly, we have 3 from mainland China, and they successfully graduated. They are also working in Hong Kong in different organizations right now, if I remember correctly. I don't remember there are more, but at least 3 I can recall the names. In fact, we also have students coming from Macau as well. So just like Olivia mentioned earlier, it's pretty logical because people who have fluent speaking can be speaking fluently in Cantonese. So we do have students from Hong Kong and China, so if not study relevant courses, not from relevant discipline, someone is a work in related industry, and the other question is not working in related in industry, would that be very difficult to have interview opportunity? Not really. I think we look at a basket of factors. We look at your academic merits, and I think it's in general as well. So we also quantify what kind of study area that you were in. I recall that we have those doing law degree. I have a very good graduate that has some civil engineering. So quantitative finance as well, I remember. So it's very wild actually. And but I think we look for people that can be successful. I think you also, some of you asked the question about dropout rate. I think not only you concerned about that, of course, you need to spend your effort, you need to spend your tuition, you care about it. However, we also care about it because I would say that an MST offer place is pretty precious. And Olivia will share with you a little bit more about the admission statistics. And we actually don't want the student who cannot successfully complete the course, because actually it will be such a waste for us. And then and our profession would not be able to have one more ST serving them. So this is my response. And for the exact GPA requirement for entry, we do not have an exact GPA requirement. Honestly speaking, I think if you are comparing graduates from different schools, Hong Kong and overseas, they are from different disciplines. The weighting is not the same, because if you do GPA very good in one university versus someone that have exact GPA from another university, it cannot be directly comparable. So that's why we need to take a look at a basket of factors as well.
Let me talk about statistics. There's a question about the statistics on previous admissions. What I can tell you is that in the last year, we have more than 200 applications, and we have admitted 31 students. Because there are lots of data, I can only tell you what we have for the last year. And there's a question about an intended number of intake this year, and we intend to intake 25 students this year. Yeah, this is the number.
Yeah. A quick one is about validity for DSE result. There's no validity period, it's forever. So that one is easy. And if I have a master degree of ST but not a bachelor degree of ST, can I still get the license in Hong Kong and Macau? Okay, I only know a little bit about the Macau license. So for more information, you need to look you need to look for information in the Macau authority. For Hong Kong, now is under the accredited registration program, so you do not have a statutory registration. So by law, you don't need to register to practice as speech therapist. However, just like Dr. Leung shared earlier, for a program which can be for a local ST training program, which is endorsed, getting full endorsement by the Hong Kong Institute of Speech Therapists, then the graduate from that program will automatically have the eligibility to register as accredited member in HKIST. That means it's some kind of a license that we use in Hong Kong, but it's a voluntary license. So if you don't get that license, you are still eligible to practice. However, I think now more and more employers, they are looking for people, they will be having the kind of membership and also the eligibility to practice. So I think in all the government and non-government or even in private organization, I actually don't see someone that they don't possess this kind of a qualification and they can get employed to be to practice at ST. I don't see that. And this is a question I tried to answer, why admission fee was raised. And actually, I think admission fee didn't increase. Last year is $450. This year is still $450.
So, yes, the same.
So, and why, if the admission fee raised or not, that is beyond my scope.
I think it's about
tuition fee. So, and the tuition fee is raised. It is the decision of our academic registry. So it's a university decision. And I actually asked, but then I was given an answer is due to inflation. This is what I got from our central management. And any info for financial support from the government or elsewhere. If you are a Hong Kong resident who will have the eligibility to apply for government sponsorship in study, actually there is a non-means tested loan. It's a loan from the government, which is called there's a non-mean tested loan scheme, which is for Hong Kong eligible Hong Kong resident to apply for, and then you can borrow money for this study. As far as I know, a lot of our students actually borrow money from this program, and you need to return it. It's not free, and then but you return it after graduation. You can go to the student subsidy department. Hoc Zichu, the local government department running the program. The program, they specify, I cannot remember exactly, but you can get a loan of more than $300,000. And then that means for the rest of the tuition fee, you need to find your way to settle it if you are able to get a non-mean tested loan from the government. And this is a top-up question on summer holiday, usual period. Okay, so I answered this one. So usually, students will have a little bit of summer, because it's not very usual. The first year of student may be as a more regular, then they will have the summer holiday. Usually, it's you can say it's something middle or end of July to middle of August. It would be that period, but you would not have 4 weeks straightforward. It depends on your clinical placement arrangement, and also sometimes we will do China placement in summer as well. So you may have week 1, 2, 4 for holiday, and some other student, due to the arrangement of clinical placement, they may have week 3 and week 4 only, like that. So, and also it very much depends on, I think you also worry or concerned about students' progression. That is also one of our important mission, which is how to help students to get through the program. So sometimes all the programs are like this, particularly for clinical program. Some students may have a little bit of challenge to go through the program. Then you may need some sort of booster to help you. And so if you're a certain type of student like that, then you may have a bit of more shortened holiday. The reason is that we can only use that gap time in order to help you through the progress. So that very much depends.
You will have certain time for summer holiday, but we cannot promise that you and your friends have the same period of summer holiday.
Yeah. I mean, they do buy a ticket and go traveling together sometime, but then not everybody. Sometimes maybe I'm with a different group with her, and there's a student, and then so the arrangement may be different, then they can't. But I think students are very smart. They will always find a way to buy air ticket to go traveling. I think this is one of our strengths with Hong Kong students.
I would like to read out this question. Do the program values interview performance over GPA? And another audience asked a question, how to stand out in the interview.
Yeah, I get Dr. Lan to answer that one maybe. Dr. Lan interview most people.
Yeah.
How to stand out in interview
Yeah. And do the program values interview performance
over GPA.
Right.
I guess as long as you are invited to an interview, you have a chance. That means we have already considered your GPA, etc. So we offer you a chance to interview. That means try your best to perform yourself in the interview. How to stand out in the interview? Our advice is be yourself, be genuine. Show us what you have. And you think that you have evidence to prove that we have a reason to accept you. Please show it in the interview. And that's the advice I give you. And I have another question here. Let me read out. As a doctor in Hong Kong, can I concurrently practice an ST in Hong Kong? The answer is yes, of course. But the problem is that if you are a practicing doctor, where do you have the time to go over there?
Yeah, you're already very busy. Most doctors are very busy, isn't it?
Another question is about maybe Angel can go up with it.
Yeah, there's a question about this. I will be graduating from a master's degree in 2025 June. Should I upload official transcript? Yeah, of course. Because unofficial, yeah. Because we would like to know how well you've been doing in your master degree, in your ongoing master degree study. So yeah, that would be preferred.
And so we have other questions. If I haven't submitted IELTS result yet, would I be given the opportunity for interview in the first round? Simple answer is yes, but then when you submit your application, you also need to submit that you have applied for IELTS exam. So you usually will have a certain proof that you have applied for those examinations, so that we will know that you will have a chance to fulfill the requirement before we have a meeting conditions deadline. So we need to know that you will have that kind of possibility to meet this condition. Otherwise, it will be pointless for us to invite you for interview. So you better submit some proof that you going to do IELTS. And the other question is, I'm graduating from Taiwan with an OT degree. Is it very hard for me to complete MSc program? As I mentioned, I'm not sure about even the same university, and honestly, we do have someone graduate from very good university in many countries. And then I think whether you can complete a MSc degree is really individual merit. I can only share with you that I can recall we have one student who graduated with a degree from an institution in Taiwan, not in health profession, but she got successfully graduated a couple of years ago. So this is what I can recall. So for your information. And percentage of applicants to be invited to interviews, we haven't decided this year. Previous year, we usually invite about 100 candidates for interview for these 2 rounds. So whether this year we are going to do the same, likely, but I can't be assure you, because we also see how many people applied and also the schedule of colleagues, because running interview, it takes time as well. But this is a historical issue. And a relevant question is, will offer be released before second round interview? Yes, like Olivia has mentioned earlier, we are running on a rolling basis. So basically we interview people, we issue offer usually by the end of January. So if you get an offer, but another issue, then you also need to secure your offer by paying the caution money as stipulated by the university. In PolyU, if you are not paying that fee, then you can't secure your offer. We can't help you with that. So this is one of the conditions that you need to know. And the other is, but if you're not being offered after the first round interview, you will also be in the pool, and that will be considered in the second round. So, for the second round interview, usually we will issue offer by the end of April. But for those who didn't get an offer by the end of the April, you will still have chance to be admitted, because sometimes people will give up their offer on their way, and then so we will have places coming out again, and then you will be able to get an offer from us. So that's why it's on rolling basis. And is MST getting the application open every year? So far, yes. Future, I can't answer you, because usually our admission process is year on year. So we will complete the process, and then according to our academic registry, then we will work on the next year's admission. So right now, I can only let you know what happened for our September 2025 entry. So, I just answered. Already answered. Then I answer these two first. So I have the two relevant questions. Can graduate work in overseas, for example, English-speaking countries, and the career path to work overseas? Now, please to understand that in a UGC funded institution, even the program is a self-financed program. Our primary goal, of course, we would like to train speech therapists for working for Hong Kong. So this is our main goal. So that's why we would not particularly train our students, for example, to use testing tools available overseas like that. So this is the arrangement in Hong Kong in UGC funded institution. However, I can only share with you, we do have MST graduates recently, because usually students, when they apply to work overseas, they usually need to contact us, the program team of MST, in order to get some information vetted or endorsed in order for them to apply overseas. So I can only share with you, I have previous students, they work in England and Canada. So many of them, they choose these two countries. So I hope I answer your questions. I think I have one graduate working in Germany, isn't it, as well? Yeah. And I'm not sure about her German. I think ask her next time. And she'll come back sometime. Our graduate also come back to find us. And most of the applicant fresh graduate, and I think I answered a little bit earlier. And I think not most fresh graduate, but most fresh graduate or those with below 5 years of working experience. This is the experience we can tell. And so it's like that. So not exactly fresh graduate.
There's a question about English proficiency test. Question was, is English proficiency test proof mandatory? The answer is yes. That's our current usual practice. The candidate asked, I passed in DSE English, any flexibility in admission? Unfortunately, we have been doing this for through all the years. We do expect English proficiency higher than pass in DSE. And for candidates who might not have had a satisfactory result in the DSE exam, for example, you can always apply for TOEFL or IELTS, because we do recognize TOEFL, IELTS, and we do put down the score requirements in one of the slides that we will put up on the web. So do pay attention to that. And as we have mentioned, those applicants whose language proficiency test results are not yet released, they can still apply but they have to attach a proof that they have signed up for the test with the specific test date, so we know it is possible that they can fulfill the requirement. And if we review the application and consider that the applicant is suitable for an interview, we would still invite the applicant for the interview. And if we consider that the applicant, after the interview, if we consider that the applicant is suitable for admission, we will give a conditional offer. Okay, and the offer will be conditional upon satisfying the English proficiency test requirements. Yeah, so that's the usual practice.
Our question here is that will it be more competitive for interview if someone got a first honor degree in a non-related subject? The answer is yes. That means it proves that you have certain academic abilities. But then you have mentioned because of first degrees in a non-related subjects, then it's your responsibility to provide further evidence for us to consider. Why is your application needed to be considered? That's one thing. You may be able to do that in your personal statement and also the evidence you provide for us to see. And the second thing is about you have studied A&P and advanced preparation. Apart from that, any preparation will be welcome because that shows that you are pretty eager and pretty prepared to be a professional therapist. If you show us that you have already done something related to your preparation, please show it to us, and this will soon be considered.
Yeah. So there's a question about are people less sensitive in sound eligible to be an ST? So I'm not sure what exactly less sensitive in sound, and not sure whether you're referring to hearing impairment or what. But I mean, you probably will. I think you need to take a look and think about your ability to discriminate some sound. I think the reason is speech therapists we will use our ear to do perceptual evaluation on speech sounds. So there are subtle changes in those sounds, and they're not only about the articulation accuracy, there will be also about some quality of the speech sound. So that's why you need to consider this is some of the requirement. And the other is how many people are accepted every year. Historical record is it's ranging from 31 to 47. So that is previous year. And like we mentioned, in the coming year, and then currently we are looking at we will admit about 25 students. So it's a little bit less than before. And the reason is I think some of you or the audience also know that because we are concurrently running a bachelor's program. So we also need to be taking a look at our manpower situation, and then because we have our commitment to our student and to the profession when we are offering this program. So that's the reason. And let Angel answer this. Is GPA important to gain interview opportunity?
Yeah, we do. So, okay, the question was GPA. Okay, let me just repeat again. Is GPA important to gain interview opportunity? We do consider GPA as well. Actually, Dr. Janet has already addressed this kind of questions. We do consider GPA, but we also consider other factors, and we don't have a specific cutoff for GPA because we also consider the academic reputations of the university. Yeah. So to give maybe some more specific examples, if you have a bachelor degree of GPA 3.0 something, I think you don't need to be too worried. Even if it's slightly before 3, but it's coming from a good university, we do have cases that we invited them for interview, so we don't need to be over worried. But if you're talking about a GPA of 2.0, maybe that's a bit of concern. Yeah. So that's more concrete elaboration.
In that case, you have to be responsible for showing evidence. Why is your application needed to be considered? So either put it up in your personal statement, or you provide further information to suggest that that GPA doesn't reflect your true abilities. So, but that's a collective type of consideration we want to consider on top of GPA result.
There's also another question about IELTS. The question was, does IELTS need to be taken before a specific deadline? The answer is yes, but then we do give conditional offers. So for applicants that we consider suitable, strong enough to admit it, but just lacking English proficiency test results, we can give conditional offers. But there will be a specific deadline required by the university to fulfill the conditional requirement. That will be around mid-July. Mid-July, yeah, but don't wait until that late. Yeah.
So I think we will address the last couple of questions before we end this session this evening. So the first question is about Zoom recording of this session. When will it be available? It will usually be available within 1 week, because after the recording is done, we have a colleagues work on that, and then we will upload both the video and also the slide deck of this presentation to the website of our department, CBS department. And one question I want to address is, do you think the job market can absorb the force in the future? You are talking about the workforce. I will only say that I really don't have the crystal ball, but actually, back at the time when I was a student, which is a little bit some time ago, I think I asked the same question. And because that time, we do not have STs in elderly setting. We only have a little bit of preschool work, a little bit of hospital work. So that time, and then I also asked questions like this. But that's why I said I don't have crystal ball, because nobody would imagine that now we have about 200-300 of jobs only in mainstream schooling. And nobody would imagine there's some job, home service that we work with those with intellectual disability or old age people. And we never have thought about it. Back in the time when I started practice for elderly, after you discharge from hospital, of course, you'll be given an appointment, but it's once, maybe every couple of months, 6 months later, and then it will be less frequent afterwards. And we can only see the elderly people. If you want to have a speech therapy appointment, you can only go for private, very expensive, and also very difficult to get, not only expensive. So that's why I said, I think Dr. Lun taught me something, said that whether we can create more position in our profession, it very much depends on us as a whole, as a profession. And I'm thankful that I think our alumni, our students are pretty good. So we still have jobs. So I will be saying no.
There's still a lot of room, because if we look at the number of speech therapists to population ratio, we're still far lower than those in the more advanced countries like the States or the UK, where speech pathology or speech therapy profession is more developed, a lot of therapy.
Yeah, so just a very quick one. I think we already addressed it. Personal statement more important, or interview of performance or academic result. I would say that your personal statement, your reference letter, and your academic result will give you the entry ticket to an interview. So because you need to, what will happen is like this. We have those information you submitted before the stipulated deadline. We talk about it, which is 16th of December for the first round, right? Because it takes a few days for the system to load those data so that the department, our department, our staff can get into it. And then, so the procedure is like this, and then we will have admission panels, and then they will review more than one person. So it will be a couple of people review the applications. And after that, then there's a process of voting to get the interview opportunity to how many number, then you'll be ranked, and so that we will offer the interview opportunity. So usually 1 week before our interview date, then you can receive an interview invitation by email. Yeah, so this is what happened. And so you need to show us, that's why we said that it's optional to get a reference letter. But if you were me, that you see applications with references letter with very good references, versus someone same academic standard, similar, but similar work experience without references letter, how would you rate this candidate, right? So I would encourage you, if you're going to apply December, now it's already going to be middle of November, please add early. If you're asking your previous colleague, previous boss, or previous teacher from the university to write you references, then you need some time for them to add on your request. So that will be helpful. And how to prepare your personal statement also, like I think Dr. Leung mentioned earlier. So how would you let us know that you actually want to study and why you want to engage in the professional practice of speech therapy, and why you would like to study now? Like, for example, some people you may not study for some time. Then I think you have to convince the admission panel that why we would like to give you an interview opportunity, because we know that we also want to make the best decision possible, but you need to help us to do that.
There are two more questions. One is, I have graduated for years and have few years of work experience. Eligible to apply MST? The answer is yes. No matter where you are fresh grad or one who has several years of experience, still eligible. And then will the offer be released through emails or phone call? The offer and also the invitation of interview will be released through emails, not phone call. Okay.
Yes.
Any other questions?
Yeah. So I think we sorry that we are overrunning a little bit again, and so for further information, if you have problem accessing the e-admission system, we mentioned earlier in the earlier slide, we show you that you can contact our academic registry, because the e-admission system is managed by academic registry, so we can't do that part for you. However, so some other general information, please feel free to email Mabel, and Mabel will usually give you the answer, because Mabel worked with us for years and then she's very familiar with the admission process. And and again, so I think this concludes our seminar for this evening. And thank you very much for coming. And again, I very much look forward to seeing some of you if you're interested to meeting us in person and to take a look at our STU. You're more than welcome to join our physical admission seminar, which is will be held in January. So how to register, when will be the date, and then you can stay tuned. You can stay tuned in the CBS Facebook, and then usually, and then the information will be released there. Or you can take a look at the top postgraduate admission website of MST from the PolyU TPG top postgraduate website. Then you can, because for the interview information, or for the info seminar information, you'll be seeing it there. And the next info seminar, the physical one, will be conducted in PolyU campus, and it will be conducted in Cantonese, just so to let you know. So again, thank you very much for coming. So have a nice